Thank you, Mr. Chairman. I'd like to thank you for bringing H.R. 3 before this committee. Many of our constituents are going without medication that they desperately need, and the lives of countless Americans are hanging in the balance. I represent a constituency with some of the poorest health outcomes in the country. They are highly dependent on having access to quality, affordable medication. Make no mistake, many are alive today because of advancements made in medicine and because of the coverage that they get through Medicare, Medicaid, or private insurance. But far too many are drowning in health care costs, unable to save, plan, or provide for their families effectively because of the rise of health care costs dwarfing their income. I'm reminded of a constituent I met this year in Tuscaloosa, Alabama. She is insulin dependent, diabetic, and a single mom who works full-time as a nurse. Like many diabetics, she has taken her medication taken years for her to find the right insulin dosage and medication. Years ago, she was on an insulin that her insurance company would cover, but would make her sick and caused her to have seizures. She is now prescribed an insulin that doesn't make her sick and has few side effects, but is much, much more expensive. And her insurance company doesn't cover this better insulin, so she sacrifices and pays out of pocket. She knows that if she cannot access the high-quality insulin that really makes her feel better, she will not be able to keep her job because of the physical impact the cheaper insulin has on her body. After applying coupons and discounts from the manufacturer, her out-of-pocket costs are $700 a month for her insulin alone. Earlier this year, she had to sell her house in order to pay her medical bills, and she and her child moved back in with her mother. No one should be subject to less mobility or poor side effects because of the drugs that they need is financially out of reach or that their insurance company will not cover it. And no one should have to sell their house just so that they can afford the medicine that they need and deserve. I'm proud that today we are advancing a historic and transformative piece of legislation that will change the lives of so many of our most vulnerable constituents. As a representative of a district with a high population of low-income seniors, I am particularly pleased that we are lowering the out-of-pocket costs for seniors by capping it at $2,000. The absence of a cap in the current Part D design creates a scenario where seniors can see their financial stability stripped away due to unlimited liability that they face in out-of-pocket costs. We fixed that in this bill today. For many of my constituents, though, even $2,000 is not manageable. The median household income in my hometown of Selma, Alabama is $24,000 a year. It's even lower for our seniors. As you can imagine, burdensome first fill costs that require patients to pay high costs upfront create a huge barrier to financial stability far too many times. I was proud to work with Congresswoman Eschew on a provision to provide more financial certainty for more than 100,000 seniors in my district on Part D. Our provision allows beneficiaries with high-cost drugs to pay their cost share in equal installments throughout the year instead of paying it all at once. We all have constituents who would benefit from this. I was also proud to work with Congresswoman Haley Stevens, Johanna Hayes, and Annie Custer to get the Maximizing Drug Coverage for Low-Income Seniors Act included in today's bill. Our measure provides for intelligent assignment of low-income subsidy-eligible individuals so that Medicare can better prioritize enrolling patients into high-quality plans that fit their needs. Mr. Chairman, I want to again commend you and your staff and all of us for working so hard today on these important provisions in this bill. While no bill is perfect, I do believe that we're making a very important step forward when it comes to lowering prescription drug costs for all Americans. I support this bill, and I yield back my time.
Thank the gentlelady.